And while corona positive cases are rising all the time across the country, so are the recovery rates. Many people have recovered from COVID-19. We have a COVID survivor with us today. Kiran Mazumdar-Shaw, the chairperson of Biocon, joins us. And welcome back in a way, Ms. Shaw. Fully recovered, what's it been like?
Well, first and foremost, Rajdeep, I don't want to call myself a corona survivor because I just want to let people know that it need not be a life-threatening disease at all. I shared my COVID story for many reasons. One was I wanted to remove the stigma from, declaring that one has caught the infection and one has tested positive. And the other one was because of the kind of mild disease that I went through, I wanted to share my experience and so that people don't get alarmed about contracting COVID. And I also wanted to share some of the lessons I've learned from COVID, which I thought could be useful in managing the disease. So that's why I basically wrote that diary and that blog.
It's a very interesting diary and a blog you've written. I just want to what's the biggest lesson? Let's turn to that. Since you're saying that you wanted to share the lessons that you've learned as someone who's not a corona survivor, as much as someone who had corona and has fully recovered, what's the biggest lesson?
Who has battled corona. Yeah. So I think one of the lessons that I learned during the corona, fight that I had was the fact that one must test as soon as you perceive some symptoms. Doesn't mind how mild they are. But the early testing actually allows you to be treated early and you will actually go through a mild experience is what my belief is. And I have actually over the last 2 weeks, Rajdeep, as you can imagine, ever since I sort of put it out on Twitter that I was positive, of course, lots of people whom I know reached out to me saying, oh, we've tested positive, what should we do? And in each of these cases, I've been able to guide them and counsel them, and all of them have basically come out of this just like I have. Many of them have gone through a slightly worse kind of an experience than I have. But I now know that people who have tested early actually have come out very easily. And people who are in denial and who kind of delayed the testing have actually had more severe symptoms. So that is the first lesson I learned. And I want everyone to know that early testing actually ensures in most cases that you will have mild disease. And the more you are in denial and the more you delay your testing,
one of the...
you may, get a severe...
One of the interesting aspects of your blog, ma'am, is what you have told us, which many of us didn't know, is that you asked for a CT, a cycle threshold value, to assess your viral load. And you say, when I saw it was 23, I felt the load was safe enough for me to be home quarantined under tele-supervision. Please explain to our viewers, to us, what is this CT value test that you did to test your viral load and where do you get it done?
First and foremost, Rajdeep, I don't think anyone realizes, but any time you do a RT-PCR test, there has to be a CT value. The cycle threshold value simply means how many cycles of amplification did it take for your result to come positive. So lower the number, higher is the viral load. Normally, it is accepted that below 20, if the positive reading comes below 20, you have a high viral load. And in my case, I had a moderate viral load of 23. And I felt that since my symptoms were not severe, I felt like home quarantine. But the most important thing I did was to measure my inflammatory markers, because inflammatory markers are very important in COVID to measure. So the moment I saw that my inflammatory markers were also low, my CT values were moderate, and my symptoms were mild, I felt I was safe enough to quarantine at home. But what I do believe is that if you have a
So
high...
are you saying, ma'am, that are you saying everyone who does an RT-PCR test should also do this CT value
It's
test?
not
And when
also
you get
do.
it done, is it freely available?
Look, Rajdeep, when you do an RT-PCR test, you have to declare the CT number. People don't realize this. An RT-PCR number is not just positive or negative. It also comes with a CT number, which nobody looks at. Now, of course, there are lots of... We will not confuse the CT number by saying it indicates severity of the disease. No, that it does not. Okay? But what the CT number does tell you is what is your viral load. And at least there may be many debates about the low viral load numbers, but if you look at any CT number that is below 20, it obviously indicates a high viral load. Now, that high viral load is one of the risk assessment factors, saying that if you have a high viral load, there are two things. One is, if it's a young person who is asymptomatic, obviously this person with a high viral load is a potential spreader of the disease, right? A super spreader. If you are an older person, say above the age of 50, if you have comorbidities, and if your symptoms are pretty, noticeable, like high temperature or cough, then your risk factor actually increases, which means that if you have high risk factors, it's better for you to be supervised in the hospital rather than home care. That's the way you have to look at the CT number.
So what you are telling me is that if you are below, let's say 23 or certainly below 20, then you should admit yourself to a hospital. If you are above
Not
23 in your CT load factor, then...
No. Rajdeep, please hear me again.
Not necessary.
Not necessarily. If you have no comorbidities, if you're young and you have a high viral load, you don't need to go into a hospital. You can self-quarantine, home quarantine, but strictly adhere to it because you're a super spreader of the infection, right? So especially if you have people at home, you should be careful because they can easily catch the virus because you have a huge viral load, right? But you can home quarantine if you do that safely. But if you have got high viral load, you are over the age of 50, you have diabetes or cancer or heart disease, then I think it's better for you to be in the hospital. Because in a hospital, if the high viral load does not get contained fast by your body's own immune response, you can start getting into a hyperimmune response, which is about inflammation. Then it creates hypoxia and all the complications that happen with COVID.
Let me turn to your daily dose of medicines that you took. You said you were put on a course of favipiravir, azithromycin and paracetamol. Apart from this, you say you continued with your daily dose of vitamin C, vitamin D, zinc, baby aspirin and Chyawanprash, not to mention twice a week 200 mg dose of HCQ.
Yes.
And these were mild symptoms.
Yeah, but the other medicine...
I presume that if you had... So you have a very different treatment for mild symptoms than you would have had your symptoms got severe.
Yeah. So generally what happens is when people go to the hospital, little bit worse symptoms than what I have described, I think they have immediately, most of the patients have been put on a combination of remdesivir and dexamethasone. And that itself sorts out people if they come early with a little, more symptoms than what I have described, right? Like, for instance, if they've had high viral load, if they have high fever, they have a cough, those are the kind of things. And then they're also got comorbidities or they're slightly over the age of 50. Then all these then come into effect and you have to take a chest CT. If you have seen any pneumonia patches, then this is what they normally do. And the good news is that in a hospital, you can be managed very well. And most of these people within 5 days can go home and continue with just a simple supportive care at home, where they don't need all these hospital interventions.
You know, you've gone through great detail in the lessons that you've learned, apart from, of course, saying don't panic on testing positive. You've also suggested that you need to monitor your oxygen
Yeah.
saturation several times a day to ensure it doesn't drop below 95%. Obviously, what you're saying, while don't panic, but also don't get complacent. Am I correct?
Yes, absolutely, Rajdeep. Because this is a disease that we are learning so much about every day, right? So as you learn from the disease, like many people who have
Yes.
said they didn't have breathing difficulty, but they suddenly realized that their oxygen saturation level had dropped. So that was a worry. So that is why you are requested to keep monitoring your oxygen saturation levels, because you don't even realize when it drops. And the other thing is, you should sort of measure it after a little bit of a brisk walk or some exercise to make sure that it's not suddenly dropping, because that all indicates that there is some hypoxia setting in, which is not good.
But you obviously had the benefit, let's say, of telemedicine, of being in constant touch with the doctors. What does an average citizen do? I mean, if you home quarantine yourself, how do you ensure that you are getting the right medical supervision, treatment, guidance? Is a question a number of people have been asking. So as someone who's gone through it, you were obviously privileged enough to go through telemedicine. Many others may not have that opportunity.
No, I think there are a number of hospitals that actually are offering telehealth support, okay? And it is for patients to reach out to the hospital chains and say, look, I'd like to be supervised. There are doctors who are very willing to do that. I know that my own doctors whom I mentioned in my blog are telling me that they're being inundated with requests to see whether they can help. So they can't help everybody, but they're getting their other colleagues involved in helping these patients. So there are a number of these kind of telehealth helplines available. In fact, there are many companies now who are just focusing on telehealth support for COVID patients who are home quarantined.
I must ask you in conclusion, you seem to have sort of got yourself through a fitness regime also, short walk, yoga, a diet of fruit, vegetables, lentils, cereals. So you've really made an effort to ensure a sort of 360-degree approach to combating or battling COVID.
Well, Rajdeep, I must confess I was doing all this before COVID, okay, and before I tested positive for COVID. So it's helped in a way.
Okay.
What I was trying to say was that you must continue with that during COVID. And in fact, if you have COVID, it should in fact become something you should adopt, because I really think it's about health and fitness. And it is about keeping fit and trying to basically keep your lungs active, and lungs, strong. So in fact, I heard one of these kind of experiences by a famous singer who said that he kept singing to make sure that his lungs kept being strong. So I think you should find your own fitness level and do whatever it can. A lot of people are very familiar with yoga's breathing exercises. So I think you should use whatever suits you to try and keep fit. Even just using the spirometer.
I must tell you, I've been doing a 45 minutes walk. I've been doing a 45 minutes walk in Corona times, and I think I've got a little bit fitter than I was pre-Corona. But my final question, ma'am, and this one troubles me. You say my constant companions were Netflix and Amazon Prime. Avoid TV and social media as negative news is bad for fighting COVID-19.
Well,
how are you tracking the news?
Well, I only used to listen to just the headline news and then move on. Because I really feel that, a lot of our programs keep on listening to, go on focusing on the negative news. So that's why I get a bit frustrated. At this time, you need feel-good factors. You need good news. You need good stories. But I find very few of them on social media and on TV channels.
Well, I want to tell you, Ms. Shaw, every night before I end my show, I give you a good news story. And also those who are watching you today will see you today as a feel-good symbol, as someone who has overcome all the paranoias that you might have had about COVID-19, and you're smiling and cheerful. So this is good news that you're back on your feet,
Rajdeep.
and many more like you are also recovering. You don't need to be frightened of COVID, and you don't need to stigmatize someone who's got COVID-19. Thanks so much, Kiran Mazumdar-Shaw, for joining me and sharing your thoughts.
Thank you, Rajdeep.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.